second or third. John Abraham does this bodybuilding competition thing out at ICC North. And there is a lady who is going to be there and speaking, who started exercising when she was 72 years old. She's now a bodybuilder.
Oh my gosh.
And she's in her 80s. You cannot believe what she looks like. It's never too late to plant the tree.
That's crazy.
Hey, everybody. Happy Wednesday morning. The sun is shining. Yay.
So nice.
We finally got some spring weather. I'm so excited about that. Love it, love it. And I'm super excited for the show today because it's been a while since I've seen you, Dr. Christy.
It has. It seems like a really long time.
Well, it has, because generally you come on the first Wednesday of every month, and that's next Wednesday, so don't be confused.
Yeah, but I missed last Wednesday.
But you missed
the time.
We wanted to make a special date so that we could meet Karen, right? Hey,
That's
Karen.
right.
Thanks for being with us today on Healthy You. I'm so excited to hear your journey and success story. And, you know, that's what really today is all about on Healthy You, is success stories. And that gets us fired up. It gives us hope, and it gets us motivated to do something maybe different, to say, hey, well, if it worked for them, maybe it's not so scary, or maybe I should think about trying something that seems a little uncomfortable or out of my comfort zone.
It's always easier when someone else has done it first.
Yes. When you don't have
jump off that cliff. You go first and then I'll go.
Right. So Karen's already jumped off the cliff for you, and in a sense. Yeah. And so we have been talking, and so, well, I guess I should say who you are. I know most everybody knows, but Dr. Christy Durbin from Synergy Health Care and Sports Facility.
Yeah.
I said that's a mouthful, but it's awesome. I'm out there often because my daughter plays volleyball, and you guys do all kinds of stuff out there.
Yeah, the gym's always busy.
Yeah,
Super
and
fun.
I think we're going to talk about that a little bit next week too. Yeah.
Yeah.
But one of the things that you've heard Dr. Christy and I talk about a lot, and what I am just amazed by and absolutely just think it is incredible, because I love science, like it just gets me fired up, is stem cell therapy.
Yeah.
And you have lots of preventative care options, and obviously chiropractic care is preventative care. But one of the big new things is stem cell therapy.
Yeah, they're using it for so much right now, and it is just, the research is there. It's been there for a really long time, but we haven't been using it in this country. They're using it elsewhere, but we haven't really been using it in this country to do everything that it can do. It's just super exciting. But in our office, we use it mainly for joints.
Yes.
And joint repair. So but there's lots and lots and lots of stuff that's going to be coming our way as they get the research down, and as they develop it further, and have those regulations.
So stem cell therapy is not necessarily new.
No.
It's just new to what we're doing with the joint replacement.
Right.
And so, hey, if you are tuning in this morning and you have been told that you need a joint replacement, or you are in severe pain in any joint, this is the show for you. You do not want to miss this opportunity to hear Karen's success story, to learn a little bit more about this procedure. And it's an all-natural remedy to joint pain versus having that complete surgery. I know, right? We're all like, ugh. Yeah. So, okay, so real quickly, let's get, I know everybody likes to hear the success story. So I want to talk to you, Karen, because as the show was starting, before we started recording, you said you've always been a patient of Dr. Christy. So you've been going to chiropractic care for a long time. Can you help us understand why you choose to do that preventative type of care, and how that?
Well, it started many years ago. I don't know how long you've been in.
About 20 years.
20. Okay, it's been.
You don't look old enough.
Pretty close to that. Right? Pretty close to that.
20 years. Wow.
Yeah. Just suddenly. I mean, I always had a lower back pain, but I couldn't turn my head to like merge into traffic.
Oh, wow.
My neck locked up, and it's like, and her father-in-law worked with me, Dave. And he always kind of like gave you guys kudos and stuff. I'm like, I'm gonna try it, but if they hurt me, I'm coming after you, is what I told him.
Isn't that that funny how sometimes people are like, if that chiropractor hurts me, you're in trouble.
Yes,
No,
that's
I
right.
love it. So with you, when you said that, you saying that tells me that you were a little
I
nervous
was
in the
afraid.
beginning.
You
to
know,
go.
you hear everybody go, oh, once you go, then you're going all the time, and it's like, whatever. And I go every month for maintenance just because I like how it makes me feel.
Sure.
Right.
You know.
People, when they say that, I've heard once you go, you always have to go. I'm like,
I know.
you go because you want to.
I go because I
Because
walk,
you feel good, not because you have
yeah,
to, but
I
because
walk
it
out
makes
of
you
there
feel
and
good.
I feel so much better. You
You
know.
can tell, yeah. It's a preventative care, like having a gym membership or taking your supplements, right?
Right.
And so, or getting a massage.
Yeah.
You know, all of those things.
Just keeps everything in check.
Yeah, and it relieves the stress and I mean just the minimal things like that. Just having that, knowing that you're taking care of yourself makes
Right.
you feel good.
And it makes your body function better. Like just even your immune system, everything. It makes everything function better. When your nervous system is functioning properly, your nervous system supplies every function that we do. And so the adjustments help to make your nervous system function at 100%.
That's awesome. And, you know, I'm a firm believer in preventative care, obviously. And I love what you're doing. I love your passion and your energy. And so I'm excited to hear. Okay, so that's where your journey started together.
Yep.
Almost 20 years ago. You've been doing a chiropractic care for 20 years?
Yeah, and I actually...
You look so young.
almost 20, not quite, but almost. But I actually got started because of, like, my journey started when I was like 15. I was having migraines almost every day.
Right.
And so to the point where I'd go home from school, where I couldn't participate in my activities. I was really sick.
That's
you know, looking
terrible.
back,
Yeah,
I'm like,
no,
I was
when
really sick.
When you shared that with me, I'm like, how terrible, and how terrible for your mom, because
Desperate.
as moms, there's nothing worse than if your kid is sick and you don't know what to do to help them.
Desperate.
That's terrible.
I mean, we were just desperate. We did everything too. We went to an eye doctor, dentist. I had a mouth guard for a while. They thought I might be grinding my teeth. I had MRIs, CAT scans. I had a brainwave study, diabetes testing, allergy testing, like the whole gamut. We did it.
You knew you were healthy in all those areas.
we did everything. And so then finally a neighbor, I was real small town, little neighbor lady called and said, have you taken her to a chiropractor yet? My friend's son has migraines and that's what he does. And so my mom's like, no, but we'll go.
Yeah, we'll
We've
try
done everything
anything.
else, you know. So he looked at my x-rays and said, well, I think your problem's coming from, your upper neck area. And sure enough, 3 months later, I barely had headaches at all. And then as I continued with chiropractic care, I didn't have headaches at all anymore.
That's amazing. Wow. Gone.
And I stay with it. And I mean, I still do stay with it. And I can almost tell, like, ooh, I can feel something coming on. I get adjusted.
An adjustment,
it's done.
And you're fine.
Yeah, it's amazing.
Unbelievable. Yeah, that's
so
true.
that's how I got started.
Yeah.
So that's where my passion really comes from, I think, is from my experience. And so many people sit in my office and say the same thing. I've done everything. Nothing helps. And they're just desperate. And I'm like, I've been there. I know how that is.
Yeah. Yeah. And when you've been there, I've been overweight. And so when you've been there and you've experienced both sides, then you're so passionate about it, you just can't stop talking about it, and you just want to help people. So that's why we connect so well, Dr. Christy. All right, so your journey started because of a stiff neck, essentially.
Yep, stiff neck, backache.
And
I was out
convinced
of whack.
by your father-in-law to come. No better advertisement than family, right?
That's right.
To come in, even though, and then you threatened his life if something happened. He was in trouble.
And it was all in jest. It was all in jest, but I just was like, okay, I'll try.
Yeah, so you did.
Yeah.
And how quickly did you start to see results?
Well, it was really funny because the first time when I was sitting in her office and there was an x-ray on the wall and I was waiting for my consultation, after my consultation, or I had the x-rays and then the consultation. And I looked at that x-ray and I'm like, well, whoever that is really jacked up. And it was mine. It's my x-ray.
You can actually tell?
Oh my God, my hips were like way off. And I'm like,
I didn't know that. That's so
know
funny.
that? Oh, honest engine here. So
That is hilarious.
Yeah.
And so you just knew.
So I didn't have to say anything.
Like,
she was sold already.
Yeah, you didn't have to walk in and say, Karen, you're all jacked up.
I just looked at it and went, ooh. person's
That's
in bad shape.
amazing. Yeah.
Yeah, that's
So, and that was you. It was your
me.
X-ray.
That was me.
And
Yeah.
so when someone's, without better words, all that jacked up, how long does it take to start seeing the results and start getting them back in alignment where it kind of holds and
tell.
stays?
It took a while for
Yeah.
it to actually hold. Yeah.
Everyone's different. So I usually tell patients when they first come in, depending on how severe it is, you should see changes in 2 weeks.
Okay.
Like in 2 weeks' time, if you're not seeing a change at all, then we're going to mix it up a little bit. But that change might just be, well, I could stand for 15 minutes without pain instead of 10.
Right.
It might be real small, subtle, very subtle changes in the first couple of weeks. If that's not happening, then we switch up therapies or switch up the way we're adjusting. But after a month of care, most people are feeling pretty good.
Yeah.
You
Would
know,
you
like
say
they could make
after
a
a month
difference.
you could tell a difference?
Yeah, thereabouts. I mean, but we have to remember too, I had this backache from the time I was pregnant with my son. So we're talking years.
Yeah, and that makes a huge difference.
So you had this backache for
Oh,
years?
yes, and I told
And
my
walking
doctors,
around
it's like,
with it?
oh, my lower back hurts, and nobody ever did anything.
Are you guys listening? Does this sound familiar to you? I see this all the time. Women walk in curves and they're just in severe pain, and I suggest to them, good supplements or coming to see you, and they're like, no, I don't
keep that
pain. I think we get so acclimated to it, and we just think that there's no hope or something.
We live with it, yeah.
Or we go to the traditional doctors, which we love traditional doctors, and they're much needed, but sometimes the prognosis, like for example, I've had members say, they told me my only option is to have a knee replacement, and I'm not doing that. And it's like, okay, well, there's some other options.
Yeah.
So speaking of knees, so the journey, you've been going to Dr. Christy for a year. So then when you started having knee pain.
Well, I had about 4 weeks to pack up a 3-bedroom house or 4-bedroom house by myself and get moved out. So thinking that I was doing myself a favor by bending at the knees to lift these boxes.
Right. Oh, goodness.
Messed my knees. Well, my knees were cracking anyway, so because I had like bone on bone type. And so then they started swelling, and so after 4 weeks of that, I was in agony.
And you go to Dr. Christy.
And she was telling me about her dad.
Yeah.
Who had the procedure, and I'm like, well, if it was good enough for him, it's good enough for me.
Yeah,
and that
she's
was
just like,
it.
just sign me up. I'm like, are you sure?
Isn't that wonderful because of the loyalty
Right.
and the trust? Then she knew you would not lead her down the wrong path.
Right.
And so that was it was perfect. It was a perfect recipe for success because
Right.
you had already been experiencing the result and benefit of long-term chiropractic care.
Exactly.
And so, which, by the way, it does take time. And like you said, it took a long time. You stuck with it. You didn't just try it for a month and then go, well, it's not much better, I'm going to quit.
Right.
You kept going. It's kind of like exercising. The
process.
more you do, the better. It doesn't happen overnight.
Right.
And so you said, sign me up for the stem cell therapy. It just made sense to you. And so what is stem cell therapy exactly?
We use amniotic allograft. So we use stem cells that come from a live birth. The mom donates the placenta and the amniotic tissue to science.
Okay.
She's screened. The C-section is scheduled, so they know when they're going to come in and get the tissue. The tissue goes to the tissue bank, and there they start to grow the stem cells.
Right.
And so whenever we need the amniotic allograft is what the terminology is now. It used to just be stem cell, but now they call it amniotic allograft. Whenever we need that, then the company that we use, they harvest it and get it ready for us. They put some growth factors in there which help it know what to do, and cytokines and some other things are in that matrix. And so then it overnights to us, and we use it the next day.
That's unbelievable. And your stem cell is the master cell.
Right.
So help people understand.
Sure.
Yeah, help us understand what happens to that stem cell.
When we inject it in, the matrix, when we inject that in, it has cytokines in it, and the cytokines kind of tell the other cells what to do. They're like the foreman on the job. And so stem cells are attracted to inflammation. So of course, if you've been told you're bone on bone, you've got inflammation. So
Sure.
those cells know to latch on to that tissue that's inflamed, and then the stem cells just start to replicate that tissue. So stem cells can grow into any tissue. They can grow into any type of cell. So
it's
let's
your master cell.
Yeah, it can become anything. It can become muscle, it can become bone, it can become cartilage, it can become tendon.
Isn't that
cell?
Science, I love it.
Yeah,
It's
and
so
1 in
cool.
10,000 of those, when we're first born, 1 in 10,000 cells are stem cells, because we need those so that they can become skin and can become everything that we
Right.
are as we grow.
Sure.
So those cells develop into whatever we need them to be. And so when we inject them into a knee or a joint that's inflamed, they latch on to that tissue that's lacking, the cartilage that causes the inflammation, and they start to replicate that tissue and become that tissue.
So basically, your cartilage starts to grow back.
You grow,
In a nutshell.
Yes,
You
your
start
body,
to regrow cartilage.
yes, or whatever you need. If it's tendon, ligament, it will regrow whatever it latches onto. Whatever's inflamed, it's going to regrow that tissue.
Oh.
So people who are bone on bone typically have a little bit of space still there. If they have movement, they have some space.
Okay.
If they have some space, they have a little bit of cartilage, because that's what forms
Right.
that space.
Because bone on bone doesn't mean that there's zero cartilage.
Right.
It just means that there's a space in there that's bone on bone.
In some
right?
area, it's bone on bone. So when we look at the x-rays, we just make sure that there's some spacing. That means there's some good cartilage still there. And that way the amniotic allograft will latch onto that area and start to replicate.
Wow. So tell me about your experience. Tell all of us about your experience. So from the beginning till the success, tell us that story, that journey.
Okay, so I went in and I had the stem cell, and it was simply a shot in each knee.
Did it hurt?
Well, a little bit.
Not as bad as the
Not
knee
too
pain.
bad. No, the knee
I heard
pain
it
was
hurts.
the worst.
It does hurt or doesn't hurt?
Well, most people who've come in for the amniotic allograft injection have already had cortisone injections.
Oh, so it doesn't.
And so
so
it's not like
no
worse
different.
than that. You know,
Yeah.
it's if you've had a knee injection, it's the same. It's not like it's super thick or anything. It's about the same.
It's
So
tolerable.
It's
totally
tolerable.
tolerable.
Okay, gotcha.
Yeah.
And most people who have had knee pain or joint pain have probably had shots. Did you
Right.
have shots prior to that? You actually had the
I had
cortisone shots.
1 round of cortisone in each knee,
Okay.
and it lasted not quite 2 weeks, and it's like, oh, this is just not going to work.
And
Yeah.
with cortisone too, they only allow you to have 3 in a year. So even if it would have worked great for her for 3 months or 4, she would have still had to have went back and done it again and went back and done it again.
It's a Band-Aid.
It is a
It doesn't
Band-Aid.
fix the issue.
And what's worse is the research shows that cortisone actually deteriorates the tissue further. That's why you're only allowed
It's not
3.
a long-term thing.
So the side effects.
Right.
Oh, yeah.
So you're deteriorating that very tissue that you're wanting to keep.
I know, but when you're in pain, you're almost desperate, right?
Right.
So,
Yep.
anyway,
Yeah.
so all right, so you go in, you
So
have
I
the
go
shots.
in and do that. Yep. And then I can't remember how long. A month later, I think maybe I had a round of prolotherapy. That was a little intense.
What's that?
Prolotherapy is when we add in extra inflammation into the joint. So we're actually inducing some inflammation. Karen did not have a whole lot of inflammation in her joint, even though she was having, quite a bit of pain. She really wasn't swelling up huge to stimulate that amniotic allograft as much. So we thought, let's do some prolotherapy, add in some extra inflammation, and just kind of boost it so that those stem cells would then latch on and be more active.
Oh, interesting. I've heard that's kind of the same therapy. One of the therapies that I've heard people doing is almost like re-injuring the injury.
That's exactly it.
So
Yeah.
that way your body
Yeah.
triggers, there's
And
a
that's
problem.
exactly it. The prolotherapy induces inflammation, so it's a new injury, just like
Right.
what you're saying. So it stimulates that
The stem cell to
injury.
start
Yeah,
working.
it just stimulates it all over again.
Okay, so you did that, and
I
that
did
was a little
that.
intense, you said.
Oh, yeah. And my knees got kind of really big.
You do, yeah.
'cause
You
apply
add a
heat.
lot. You do.
Yeah.
Yeah. And it's like, oh, this is a little scary. But
Sure, I bet.
You know.
Your knees swell up. That's like getting your eyes dilated. It's
Yeah.
like, are they going to go back?
But, you know, it started getting better and better and better, and it just, you know, just did nothing but improve after that.
And she was going up and down stairs and doing all kinds of, she's not a slow down kind of girl.
No, I can tell. So, Karen, how long after you had that procedure? So, from start to pain-free, what would you say the length of time was there?
Probably, I'd say probably 6 months, maybe, by the time I was in a really good place.
So 6 months total therapy, no surgery, no stitches,
surgery. I have
no
knees
downtime.
that aren't like elephants.
And so now you are completely pain-free?
Yeah.
That's amazing. And you can show her the results on an x-ray. You can see
I've seen on a sonogram all the new tissue that has developed in my knees and the space between my bones, how it's grown. So I've seen all of that.
with your own two eyes.
With my own two eyes.
And you're just grinning from ear to ear because it's like so cool.
Yeah,
it would be like if I could turn somebody inside out and show them their lean muscle after working out at curves for 60 days.
Yes.
I wish I could do that, you know, because you can't see the inside. And so being able to see that is just so cool. So you're like, there it is. There's tissue. It grew back. It wasn't there, and now it's there.
Exactly.
And you're pain-free.
And I'm pain-free.
That's the best. And so, and then it just is like her regular tissue. There's no, it's not going to just disappear.
Right. She's not going to have it again. You
You're
know,
not
like
gonna-
her knees are going to outlive her at this point, I think, unless she just has an injury or something, you know.
Right.
But yeah, it's a one-time procedure. So we don't have to worry about that tissue wearing out because it took so many years to wear it out the first time, and probably it was from an injury. And so, it's going to be there for the rest of your life. That brand new tissue.
Brand new tissue. It's like a brand new knee
Like a baby.
without having to have that surgery.
Yeah.
Exactly.
Would you like a brand new knee?
And we always focus on knees,
I
but
know,
really
but
it's any joint.
It's any
Yeah,
joint. So
any
there's no
joint.
joint. So even hip,
Shoulder, elbow,
wrist,
yeah, thumbs,
ankles.
Some ankles. Sometimes people have trouble with
Oh,
thumbs.
yeah. As a massage therapist, I would get like this jammed up feeling in my thumb, and it was like I was tendonitis of the thumb.
Yeah.
It hurts.
Yeah.
And so I always thought about that too. I'm like, man, if this is what this feels like in your thumb, I can't imagine what it would feel like in your knee or in your shoulder. That would just be
Right.
awful.
Yeah, it was.
Well, I
And
know
pain slows you down.
it does. Well, I know my dad, that's why we originally started doing it, was because my dad was told he needed a knee replacement. And he had went through, you know, he lived 3 hours away, and he had went through every other, you know, cortisone, the artificial, like spacing that they put in there. They can use chicken, rooster comb or whatever. Some people are real familiar with that. But an artificial cushion had been put in his knee with an injection, and your body just reabsorbs that after a while because it's not the real deal.
It's not the real deal. Your body recognizes it as foreign.
Yeah.
And then it starts to say, nope, we don't like that. Let's get rid of it.
Yeah. So with my dad, it was like, we got to do something else. You know,
Sure.
he's not a down, take it easy kind of person.
So is that what started you in this?
Yeah.
Wow.
Just they told him knee replacement. And I was like, 1 in 400 die doing that
I
procedure.
know. You've told me that. And remember I said, that would be like getting on a roller coaster with a sign that said, you know, get on at your own risk. 1 in 400 people die. I'm like, don't think
What
anybody
number
would
am
get
I?
I don't think anybody would get on that roller coaster.
No,
right?
you're right.
No. So, I just want people to know their options.
Right.
I just want you to know that there are options for pain.
Right.
And it's not hopeless.
No, and sometimes it just takes thinking outside the box. You know, don't do that set protocol. Think of something else. Do something different.
Yeah, and the first thing I hear when we talk about preventative care, whether it's eating good quality food, healthy food, taking good quality supplements, exercising, chiropractic care, massage therapy care, the first thing you hear is people say, "Oh, I can't afford that. I don't have the money to pay for that."
Right.
But at the end of the day, even if you have insurance, I have good insurance. For my kids, they have great insurance. And last November, Kinsley got really sick, and we ended up in the emergency room. I got a bill even after insurance. I ended up paying almost $1,200. So it's like, stop and think for 5 seconds that when you are not well, when you're unhealthy and you're in pain and you end up in an emergency room or you end up on synthetic drugs, or the lack of productivity
Yeah.
that you cannot accomplish because you're in pain, how much money that cost you.
Right.
That cost you way more. In fact, the statistics, the statisticians, the insurance people that tell us how much, what it's really cool. And their studies are pretty on point. That's how insurance companies create their pricing system. So they trust these people.
Right.
And they say that for every dollar you spend on preventative care, you save $5 in long-term health care expenses.
I believe it.
That's an amazing return. There is nothing else that you can get a better return on your investment. Spend $1, make $5.
Yeah.
I mean, that's unbelievable.
And feel good doing it.
Yeah, and when you feel good, you can do more stuff. So tell me about your active life now that you don't have pain, Karen.
Well, I just built a house. I mean, I didn't build it, but I just
But she picked out every single thing.
everything.
Yeah.
I've retired. I'm just enjoying the life.
Yeah, so you're retired, you built a house, you had to decorate that puppy.
Yeah.
She did a lot of shopping. And she
That's
was able.
Shopping is
able.
exhausting.
She was able to do a lot of shopping without severe knee pain. So
Yeah, well, all the walking.
Yes.
Yeah, that's awesome. And for activity, do you exercise? Do you
I
walk?
work out. I try to work out 3 days a week.
Awesome.
Yes.
And you do strength training and
Yes.
yay, good. That's awesome. So staying strong. And then now, so you did the stem cell therapy, and then now you just go see Dr. Christy
Once a month.
once a month
Yeah.
and stay in check.
yeah,
I love it.
it's pretty simple, isn't
I
it?
know. Well, but the thing that I'm hearing from your story, Karen, is that it's a process.
It is.
And that's what we have to remember. It doesn't
not
happen
immediate.
overnight.
Right.
You have to be intentional. You have to desire to be healthy,
Right. And even with
to really want it.
right. And even with the injection, most people think of an injection and it's going to be fast acting and it's, they're used to that quick fix.
Yeah, the Band-Aid
yes.
fix.
And this injection, it regrows tissue. So you have to give your body time to actually regrow that tissue. It's not overnight. It takes a little time for
Right.
that tissue to grow, to increase that spacing, to actually stimulate complete healing. So it continues to work for like 8 months or longer where it's working, growing that tissue.
Yeah.
So it's not like it grows that tissue in 2 weeks and then you're done. It continues to regrow that tissue for longer than 8 months.
Right. So you said 6
So
months.
6
Karen.
months for her, she started having relief. Some people it might be less time, some people it might be more time. It just kind of depends on the person.
Well, I mean, 6 months total relief.
Yeah, total
Actually,
relief.
Total
Yeah.
relief.
You were back to normal.
I was, yeah.
Most people after a couple of weeks start to feel a little bit better, just like they're moving better. But for total relief, you're looking at, months.
That's awesome. That's a great success story.
It is.
That
It's
is
wonderful.
inspiring, and I hope that it's given you guys some hope. And so we want to thank you for joining us today. It's been awesome. Can you believe how fast? See? Half hour?
very
Boom.
quick.
Done. Gone. Just like that. It's amazing. And so we've got like 40 seconds left. So I know maybe some people are thinking, well, maybe should I call Dr. Christy?
We always do a free consultation. It does not hurt to come in, get checked out, see what we can do, see if it is an option for you. It's not going to hurt.
Because in your free consultation, you do an x-ray, you show them, like what you were saying, Karen, you actually saw your before pictures and then you saw the after pictures.
Right. Whenever you do the consultation, we do an x-ray to make sure you're a good candidate. And there's no risk there. If you don't want it, then you just walk away.
Yeah, that's perfect. That's great. So you have nothing to lose. So be sure to get in touch with Dr. Christy Durbin over at Synergy Healthcare and Sports Facility. She'll take good care of you. And you're going to be back next Wednesday too.
Next Wednesday.
So we'll be back on track next Wednesday. Will be the first Wednesday. That's your day.
Yep.
And so we'll get back on track. And Karen, thank you for taking time out of your
Yes,
morning.
thank you.
Speaks,
Welcome. Thanks for
that
having me.
just speaks volumes of how much you love and respect Dr. Christy.
I do.
And so that's awesome. Thank you so much. Thanks for tuning in, everybody. We'll be back next Wednesday. Yay.
Yay. Perfect.
Yay. I know. That's amazing. So 6 months was the thing. And I think that's
PeoriaLife.com.